This is Preeti and you are watching Med Solution. In this video, I'll be discussing the RS question, that is trapezius muscle. It has been asked as a short essay. First, I'll discuss or explain through the diagram, and easily you can understand. This is a flat muscle. It lies behind the neck. This is here. Neck will be there. Behind the neck, it lies. It is when we see from one side, it looks triangular in shape. But if we consider both the sides, it will be in a diamond shape. It arises from the external occipital protuberance. Here, external occipital protuberance is a high elevation behind the skull. This is external occipital protuberance, and these are superior nuchal lines. Medial 1/3. If we divide the superior nuchal lines into three parts, this will be lateral part, this middle 1/3, and this is a medial 1/3. Medial 1/3 of the superior nuchal lines. It arises from medial 1/3 of superior nuchal lines, and this is ligamentum nuchae. It arises from ligamentum nuchae, and the spine of C7 vertebra and spine of all thoracic vertebra T1 to T12. T1, 2, 3, 4, 5, 6, 7, 8, 9, 10 and 12. T1 to T12. So all thoracic spinous process of all thoracic vertebra. It origin again, once again I'll say, external occipital protuberance, medial 1/3 of superior nuchal lines, and ligamentum nuchae, spinous process of C7 vertebra, spinous process of all thoracic vertebra, and it is inserted as a three fibers: upper fiber, middle fiber and lower fiber. Upper fiber run downwards and laterally, and then I inserted into the, this is a posterior border of the, this is anterior border, this is a posterior border, lateral 1/3 of the clavicle, posteriorly lateral 1/3 on the posterior border, lateral 1/3 of the clavicle, and middle fibers run horizontally and are inserted into the acromion process, and lower fibers runs upwards and laterally, and then they are inserted into the deltoid tubercle, which will be present medial 1/3 and middle 1/3 of the spinous process of the scapula. This is origin and insertion of trapezius muscle. You can see introduction. It is you have to write heading wise heading so that you get more marks. Introduction. It is a flat and triangular muscle, as I already said. It lies back of the neck. The muscle, it lies on, it is, if we consider this as a medial line, it lies on both the sides, two-sided muscle. Both the sided muscles are attached to each other and form diamond shape or trapezoid shape. This is a trapezoid shape. So this we call this muscle as trapezius muscle. Origin medial 1/3 of superior nuchal lines. This is superior nuchal lines. We can divide this into three parts, and this is a 1, 2, and third part is a medial part, middle part and lateral part. Medial 1/3, it originates like this, and external occipital protuberance is the highest elevation on the back of the skull. Ligamentum nuchae, which runs from the external occipital protuberance and spine of C7 vertebra and spine of all thoracic vertebra, and they are inserted as three fibers: superior fiber, middle fiber and inferior fiber. Superior fibers runs downwards and laterally, and then inserted into the posterior border, lateral 1/3 of the clavicle, and middle fibers runs horizontally and then inserted on the medial margin of the acromion process. See, you can see medial margin of the acromion process and upper lip of the spinous process. Upper lip of the crest of the spinous process, and lower fibers runs upwards and laterally and then inserted into the deltoid tubercle, which is present at the medial 1/3 and middle 1/3 of the spinous process of the scapula. Now supply will be spinal accessory nerve. Now supply for motors are now supply for the movement, spinal part of spinal accessory nerve. Accessory nerve as a spinal part and cranial part. Cranial part enters the brain and supplies the melangeal layer. But the spinal part supplies trapezius muscle, that is cranial number 11. Cranial nerve number 11. And for proprioception sensation, C3 and C4 ventral rami from C3 C4 now supplies for proprioception. Action will be for upper fibers elevate the scapula, whereas the lower fibers depress the scapula, as they both are attached to the scapula. So the upper fibers elevate the scapula, lower fibers depress the scapula. Medial fibers retract the scapula. Retract means elevating the medial border and inferior angle of the scapula from the rib cage. That retract the scapula. Along with the serratus anterior, trapezius muscle rotates the scapula so that we can abduct more than beyond the till 90 degree. It is with the help of deltoid muscle. Beyond 90 degree, if we have to abduct our arm. This trapezius muscle helps in rotating the scapula so that we can lift our arm above the 90 degree. We can abduct our arm above the 90 degree. That's all for this video, and thank you.